Thank you very much, Laura, and the rest of the panel. It has been a fantastic session, and welcome everyone to the Q&A session. So we have roughly 15 minutes of Q&A, and it was interesting to see how as soon as the talk started, we started to receive many questions. But for me, the most interesting thing was that they were really coming from very different parts of the world. So we are clearly reaching out to many different countries, and there is a lot of interest in this disease. So let's start from the first one. And so in what ways do global centers contribute to raising awareness about amyloidosis on a broader scale, both within the medical community and amongst general public? Vishali, would you like to answer to this question?
Sure. So, the global centers are absolutely crucial in increasing awareness for patients, for community physicians, for primary care doctors, and for collaborators. So within the medical community, we can increase these, the global center contribution by raising awareness of this rare disease by, providing conferences, webinars, at congresses and different meetings. And for among general public, the collaboration of amyloidosis patient organizations, national campaign, and again, that this would really lead to increasing awareness. And as we have known that diagnosis delay can really cause a decrease in survival. So I think improving diagnosis and awareness and reducing educational gap is critical for this disease.
Absolutely. I think all of us agree very much that awareness is really the first step to the right diagnosis. And this is something that Professor Rapezzi used to say every time: if you don't suspect the disease, you're never going to get the right diagnosis. Laura, what challenges do global centers face in ensuring equity access to high-quality amyloidosis care across different regions and healthcare systems?
Thank you, Mariana. This is a key question. There are several challenges, of course. One is to build a network that can help in driving all these knowledge and provide a local impact. So I think the first step could be to try to build a network around. This was our experience in Italy, and it was quite rewarding in the past. So I would suggest trying to build a sort of hub and spoke approach that will be quite rewarding. And another thing that I think is important is to try to develop recommendations on a regional or national level that can allow to leverage the access to treatment and to define the gold standard diagnostic modalities. And sometimes these kind of documents may also have a value for the costs that the health system has to support and justify these expenses. So in my experience, these agreements among physicians in a region may really support the access to treatments and to diagnostic facilities. So this is my experience.
Thank you, Laura, for sharing your experience in Italy, where you've done amazing progress on actually creating these hub and spoke model, where there are referral centers like yours that help regional centers to actually building up their expertise. And David, what role can technology and data management systems play in enhancing the efficacy and effectiveness of an amyloidosis center?
Yes, we have different tools in different centers. We record, we have large database of patients. We can have many information on the profile of the patient, different type of amyloidosis, hereditary ATTR, AL, and so on. And we can use the database to follow also the carriers, for example, for hereditary amyloidosis, to make a screening of these carriers and to follow up regularly each year to see, to detect earlier the disease and this is the best way to control this life-threatening disease.
Thank you, David. And
I think I would add to that as well, because in the United States, during COVID time, we had, the government or the third-party payers approved for telemedicines and telehealth visits. And I think that now has, since the COVID pandemic is over, the telehealth visits are not being reimbursed by the third-party payers. And I think that is a really a disadvantage for this rare disease, because patients who are really sick cannot travel to the centers of excellence, and we cannot really get reimbursed for telephonic visits or video calls or telemedicine visits. And I think that remote monitoring and remote visits are extremely crucial for a disease like this.
I couldn't agree more. In the US, we've got this model of virtual visit and in-patients visit. And virtual visit, for example, are extremely useful in patients with systemic AL, where we have the blood samples, the free light chains over time, and we can take decisions actually based on the bloods and discussing with the patient. Completely agree. And back to you, Vishali. So are there existing centers in the US, and what are regulations regarding setting up a center in New York State?
Right. So, it's a good question. So there are many centers in the United States which have multidisciplinary basic science team as well as multidisciplinary clinical teams. And there are also new centers that are coming up because, there are so many approved therapies for AL amyloidosis as well as ATTR amyloidosis. So these centers are setting up to really, give a proper multidisciplinary care to the patients with amyloidosis. There are no really set regulations to really set up a multidisciplinary center. I think you need a buy-in from all the stakeholders, the hospital, the clinic, the clinical revenue, the third-party payers, as well as obviously the patients and all the multidisciplinary team members. I think those are the important, because everybody has to learn, everybody has to work together. Communication is critical, and also then, providing that communication to the referring providers. So I think that is important. In New York State, there are several centers that specialize in delivering multidisciplinary care as well.
Thank you, Vishali. And following on that, Laura, can you summarize the key steps in setting up an amyloid center from your point of view?
Yeah, so I think the first step is to find local colleagues, possibly in the same hospital, that share some interest and belong to different specialties, and try to see the patients all together in order to discuss and to learn from local experience. And another option is to have the opportunity to have someone from your center moving for a short period, even a few days or a week or a few months, if possible, to another center, one of the maybe international recognized centers. We have a lot of people coming to our center, and I must say that after this visiting period, they're able to start with a center in a way that is helpful to understand the needs and to understand the processes that are taking place in these places. Another aspect, of course, is to find a facility, which is not easy sometimes, but having a place in which you meet, in which you see the patients all together, that's quite important. And of course, trying to find out the first patients, because we learn from experience. So I'm sure that when you have seen the first patients, then many more will come to your attention.
Thank you, Laura. And David, for you, the final question. So there is a specific question about how to start the process of setting up an amyloid center in Pakistan. But I guess this follows within another question on how do we build and maintain collaborations with other institutions and organizations involved in the amyloidosis care? So would you be able to answer to these questions and it really relates how do we set up an amyloid center in a country where there is not yet a referral center for this disease?
First advice is to go to a national meeting for amyloidosis ISA every 2 years, and all the specialists for amyloidosis are coming here to exchange their experience and present their works. So, and I think all the centers have website presenting the research work and the clinical trial, and they with the email address, and we can contact to have some advice. We receive also, like Laura, resident and fellowship from different countries, from Spain, to learn how to manage how the center is working, and the different meeting we have in the week, the consultation, day hospital, and multidisciplinary meeting every week to discuss the cases for diagnosis and for better solution for treatment. This is the way. So we know that in China we have centers, and I think in Pakistan I think it's not so difficult. Probably we need to have some specialists in our centers to train them to maybe in London, I don't know, but to best approach to learn how to see patient, like Laura say. When you have seen the first one, you see how it could be, you can recognize the other one.
Thank you so much, David. And I would also like to thank the audience, because from the long list of questions, it's really clear that there is a huge interest. And as I said, coming from many different regions, because there is a huge need of setting up more centers to guarantee quality of care across the different regions. And now I will hand over to Vishali for the conclusions.
So thank you to the panel members, as well as all the members of the audience. Hope you've learned how to set up an amyloidosis center. What are the opportunities? What are the challenges? What are the barriers? And how to overcome these barriers. I would like to make some concluding remarks here that specialized amyloidosis centers play a vital role in ensuring swift diagnosis and providing high quality care for patients with amyloidosis. The unmet need is clear. We need more amyloidosis centers that specialize in delivering multidisciplinary care. Amyloidosis healthcare professionals like you play a vital role in this process. We need your expertise and commitment to be able to set up more of these crucial specialized centers. Become actively involved in the process of establishing an amyloidosis center in your region by accessing our comprehensive toolkit of resources, and interact with experienced experts from established amyloidosis centers who can offer you specialized guidance in virtual region-specific roundtable discussions in Europe and in Asia. And with that, I would like to thank all of you, and please remember to answer the post-assessment questions. Click on the evaluation button to tell us how we did. It takes less than a minute, and your feedback is extremely important to all of us, and this will help us create the best learning experience for you in future programs. Thank you very much for your attention, and thank you to all the panel members. With that, we would conclude this session.